time to call out the BS in plastic surgery. My name is Dr. Anthony Youn, and I'm a board-certified plastic surgeon, and I'm going to reveal the 5 biggest things in plastic surgery that I think are utter bullshit. As a plastic surgeon, I've operated on thousands of people over the last 20 years. And I know that the quality of a scar is not dependent on how I perform an operation, it's dependent on how the patient's skin heals that scar. Now, as a surgeon, I can control whether a scar is jagged, I can control whether it has little railroad track marks from the sutures being left in too long, but I can't control whether a scar widens or whether a scar gets thick a couple months after the operation. That is really dependent on the patient's skin and on their body, and there are a lot of factors that go into that. Number 1, is that patient using a silicone-based scar cream? Silicone-based scar creams can help scars to potentially look better as they get older. Number 2, what is the age of the patient? In general, patients who are in their 20s and 30s, their collagen is more robust, and they may have a higher risk of a thicker scar than a patient, let's say, who's in their 70s or 80s. People who have darker skin, and unfortunately redheads, are at risk of having a thicker scar than people who have, in general, lighter skin. And there are other factors that may play into it, such as hormones. But in the end, the one thing that we know is that a surgeon cannot create a beautiful scar in everybody. That really is up to the patient. And there are certain procedures that are being performed today that I discourage younger patients from having because that scar is kind of risky. And that includes the upper lip lift surgery and the hairline brow lift. Both of these contain scars that are right on the front of your face, and if they heal well, maybe they'll look okay. But if they don't heal well, they could be really obvious. And once again, because the doctor is not in charge of how your skin heals, you go into it not knowing what you're gonna get. Every couple of years, there's a new type of liposuction that is branded as being less invasive, or tightens up skin, or it gets you a better result. And after a couple of years, it tends to fall off in popularity because people figure out that it's just liposuction. So we've had Beaver liposuction that uses ultrasonic energy to help melt the fat before it comes out. We've had laser liposuction that uses a laser device that can try to help tighten up skin. There's even funny names like tickle lipo and air sculpt, but in the end, all of these procedures are the same thing. They're basically just liposuction. You inject anesthetic fluid into an area of subcutaneous fat that you don't want, and then we take a metal rod attached to suction and we basically suck that fat out. Now, the good thing with liposuction is the fat that is suctioned out will not come back unless you gain a lot of weight. So those results are in general permanent. But if somebody tries to trick you into paying a bunch extra for their fancy liposuction that they say is better than regular liposuction, then be very careful because you might be wasting your money. The only fillers that I recommend are hyaluronic acid fillers, like Restylane or Juvederm or Teoxane. I'm also a fan of Sculptra in certain patients, but there are other fillers that I am definitely not a fan of, and these are the permanent or near permanent fillers, such as Bellafill, Radiesse, and silicone. Now, while these fillers may get you the result you're looking for, at least initially, my concern is if you develop a complication. If you, let's say, have too much filler injected, how do you get rid of them? Well, with hyaluronic acid fillers, there is an antidote called hyaluronidase, which is an enzyme that can melt that filler away, some of it within literal seconds. So if you have a lump that you're not happy with, we can inject hyaluronidase to melt it away.
You know, I don't mean to embarrass you, but I'm a rather brilliant surgeon. Perhaps I could help you with that hump.
What hump?
Or if you get the dreaded intravascular occlusion, where filler is accidentally injected into an artery, causing loss of blood flow to a part of your face, then we can try to melt that filler away and reestablish the blood flow. The problem is if you have one of these permanent or semi-permanent non-HA fillers and you get a complication like this, then you're basically just kind of screwed. You can do supportive treatments like warm compresses, like nitrobid ointment, like hyperbaric oxygen, but if you've got an intravascular occlusion and you have a part of your face that's not getting enough blood supply because that filler has clogged up that blood vessel, there's no antidote to remove that filler from the blood vessel. So for safety's sake, if you're going to consider filler injections, go with the hyaluronic acid fillers, or Sculptra is another option because it's nice and thin, much less likely to clog up a vessel, because that's going to give you the safest possible outcome. Thread lifts were first introduced back in about 2003 or so, and this is around the time I started my plastic surgery practice. And there were doctors all around the country who basically took these sutures that have little barbs cut into them. Those barbs would basically attach to the connective tissue underneath the skin, and if you pulled on those sutures under the skin, it can make it look like that skin was being lifted. And so people would undergo these non-surgical facelifts where you take these barbed sutures, they'd run it underneath the skin on both sides of the jawline and make it look like the neck is lifted. And then they would go, wow, look at these amazing results. You've got a non-surgical lift of the neck using just sutures. But what people started figuring out is that this result would only last 6, maybe 12 months total. Then the face would go back to how it started. Now that's not such a bad thing, but the problem is that the sutures were permanent. They were made of nylon for the most part, and even though the result is gone after 6 to 12 months, the ends of those sutures would sometimes be sticking out through the skin for many years even afterwards. Now the suture companies have learned their lesson, and so they're not creating these sutures with permanent sutures anymore. Now they're absorbable, which is much better. However, the results are still the same. They typically only last about 6 to 12 months or so at most. So my problem isn't so much with the thread lifts in general, because if somebody wants to spend $3,000, $4,000, $5,000, $6,000 on a 6 to 12 month result, and they're happy with that, then by all means, go ahead. I think that the risks of these procedures are not super high. But my issue is that I don't know that all of these doctors are being honest with their patients, telling them, hey, you're going to spend $6,000 for this non-surgical facelift that you're not going to see results with in 6 months. And if they're being honest and their patient wants to pay that, then that's between them and the patient. But if they're not being honest, then that is BS. They should tell their patients that these treatments do not last longer than about 6 to 12 months. Now, my number one BS thing in plastic surgery may be a bit of a surprise. Throughout 4 years of medical school, 3 years of general surgery residency, 2 years of plastic surgery residency, and a year fellowship in cosmetic plastic surgery, I learned basically zero about pre and post-op nutrition. Yes, I learned how to take care of people who are really sick in the ICU if we're going to put a feeding tube down them or give them TPN, which is nutrition through an IV, but we learned very little about what type of foods to eat or what type of foods to avoid and what supplements to take to optimize healing after surgery. So when patients would ask me, Dr. Youn, which of my supplements should I stop taking before surgery? I would just tell them, go off of everything, because I was not knowledgeable about supplements for many, many years. And it wasn't until I took literally hundreds, if not thousands of hours to really learn about nutrition and supplements that I realized I didn't know what I didn't know. There are certain supplements that can be very helpful for patients after surgery, and those include taking a probiotic so that you can help support your microbiome, especially if you're on antibiotics after the operation. They include amino acids like arginine and glutamine, which have been shown in many studies to be helpful for patients after general anesthesia. And they include zinc and vitamin C, both of these which are absolutely essential for the production of collagen, and they're also helpful for immune function. So now whenever I have a patient who has major surgery, I do put them on pre and post-op supplements as a way to hopefully improve their healing and help speed their recovery. But unfortunately, I believe that I'm one of the minority, and I think it's so important for surgeons to realize that there is so much more that we can do to help our patients with their health and their healing other than just operating on them. So I was wrong when I told my patients just to go off of all of their supplements. But there are 5 other things that I was definitely wrong about throughout my career. This is something you won't hear from plastic surgeons or really in general doctors. But I go over those 5 things in this video right up here. It's kind of humbling. And remember, eat real food, use clean skincare, and auto-rejuvenate before you operate.